Launching and growing a successful in-home healthcare business is no easy task. It takes great staff, great service, and great care, but it also takes a great understanding of your numbers. So in this video, I'm going to give you a high-level view of the numbers that you should master before launching your in-home healthcare business. Now, it really all comes down to four things: your sales, your gross profit margin, your overhead expenses, and your cash flow. And as you'll see, there's a whole bunch of levers that we can try to push or pull to impact these numbers, but we're going to start with sales. Now, for an in-home healthcare business, your sales will likely come in one of two ways: from referral partners or advertising. So developing a strong network of referral partners that may consist of physicians, various medical facilities, and other trusted partners is a great way to generate recurring referrals of patients that may need your care. Another great way to generate leads is through advertising. And ultimately, you're going to have a cost to acquire a lead or a customer, whether that is an advertising cost per lead or an employee cost for the employees that are out and responsible for building those relationships with referral partners. Now, once you have leads, you can expect that you'll convert some percentage of those leads into patients. And once you know your projected number of patients, then I would project an average number of hours of care that you will provide per patient and the average dollar rate per hour for your services in order to come up with your total sales. Now let's jump into gross profit margin. In the in-home healthcare industry, the target gross profit margin should be around 30 to 40%. That's according to an article from USA Today. And your gross profit margin is a function of your billable rate per hour and your labor cost per hour. So gross profit margin is calculated as your labor cost per hour divided by your billable rate to the patient, or to the insurance company, the payer, per hour. So if you are billing to Medicare, Medicaid, private insurance, these billable rates are going to be set with a particular reimbursement rate. And so the only thing you can really do to impact your gross profit margin is try to find low-cost labor while also maintaining a great quality of care. And when thinking about what you can pay your employees, you need to keep in mind their total hourly cost to you. Now, there's a difference between their hourly wage rate and their total cost to you with taxes and benefits included. You'll need to include all of those costs, taxes, benefits, and anything else in a per hour wage rate to calculate your gross profit margin. Now let's jump into overhead expenses. We have talked about sales, gross profit, and the final piece of the profitability puzzle is really your overhead expenses. These are expenses like rent, salaries and wages of your admin workers, utilities, advertising, etc. And these overhead expenses will likely increase as you grow. For example, the number of back office or administrative employees that you're going to need when you have 2 providers caring for patients is going to be much less than when you have 20 providers in the field, right? So what I would recommend is that you start by calculating the bare minimum of overhead expenses that you absolutely must have in order to open up for business. Now let's say that number is $3,000 per month. Now you can work backward and figure out how many billable hours will you need to provide at your target gross profit margin in order to break even. So I'm going to take you back to high school algebra class to calculate your break even. To determine when you're going to break even, the calculation will be monthly sales times gross profit margin minus overhead expenses equals 0. Why 0? Because when this equation equals 0, that means you're breaking even. You're not showing any profit, you're not showing any loss. Now let's say your minimum overhead expenses will be $3,000. And you also know that your target gross profit margin is 30%. So if you remember from algebra class, in order to calculate how much in sales we need to generate in order to break even, we can add 3,000 to 0 and then divide by 30%, which is our gross profit margin. And we're going to be left with the sales amount we need to break even. In this example, that is 3,000 divided by 30% equals $10,000 in monthly sales required to break even. Now let's say you go through your sales projections process and you don't think you're going to be able to hit $10,000 in monthly sales. Well, your challenge in this business is that your profit margins are basically set by the payers, the government and insurance payers. And if you can't figure out ways to cut your overhead expenses, the only option you really have to break even is to try to grow sales as fast as you possibly can to get to that break-even sales level. Now, the last thing I want to mention is that once you reach break-even from a profitability standpoint, you still have one major problem, and that's cash flow. Cash flow is a real challenge for in-home healthcare businesses because you will likely have to pay your employees every week or every 2 weeks, but you may not get paid by the government or insurance companies for months. So in theory, you're going to get onto this kind of regular payment schedule and be getting paid for work that you did months ago. You'll be getting paid every week eventually, most likely. But if you do anything wrong when you submit billings and they get rejected for payment, you can expect additional delays. While you're waiting to get paid, you need to continue to pay your employees, pay your rent, pay your utilities, among other things. And so I would recommend that when you start, you have at least 3 months of expenses in the bank in cash to cover your cash flow needs while you get started. So we actually have a financial projection template that's built specifically for in-home healthcare businesses that's going to help you lay out all these costs and sales assumptions and just make it a lot easier for you to develop your projections. So next I'm going to dive into the details of our template and actually show you how to build out your financial projections.